CARPL.ai, Vidur Mahajan.
Hey, hi, Yuli. Thank you so much for giving me the opportunity to present some of our work. I'll
Sure.
just quickly go ahead and share my screen. Hi, everyone. My name is Vidur Mahajan. I am probably a physician gone rogue. So I studied medicine, transitioned to the management side, did an MBA from University of Pennsylvania, then became a researcher for some time, then ran what is India's biggest medical imaging company. And now I run CARPL, which is a analytics startup. Essentially, we are a network. We connect AI applications for radiology with healthcare providers. And the idea, of course, is to solve for the triple aim of access, affordability, and quality of medical care. So if we look at the world of diagnostics today, essentially it's divided into lab medicine and radiology. Lab medicine is completely transformed by automation and robotics, right? You go into a lab. This is DASA's lab in Brazil. It's the biggest Roche facility on the planet. You will see exponentially more machines than people here. And pathologists sign out thousands of tests a day and only review with their eyes, especially in hematology, the edge or the abnormal cases. And this has led to democratization of blood testing globally, right? You can be anywhere on the planet and you will be able to get high quality or reasonable quality, reasonable affordability in lab testing. On the other hand, radiology has been fairly standard. Patients walk in, we use scanners to take images, radiologists look at these images, either write or talk or type reports that are eventually sent to clinicians to treat these patients. There are an innumerable number of applications that are coming up in this domain of radiology automation that are trying to address very niche attempts, niche pathology, modality, body part combinations like chest, X-ray, pneumonia, head, CT, stroke, so on and so forth. And they're also impacting various aspects of this workflow. But it's extremely difficult for any healthcare provider to first access these hundreds of solutions out there, assess them, whether they even work or not, because it is AI at the end of the day, somebody needs to test it out, and integrate and monitor them in their workflows. And that's what we are building with CARPL. We are nothing but a connecting layer with healthcare providers on one side, AI applications that can do a bunch of things on the other side. We are the middle layer. What that enables us to do is take these automation tools into healthcare providers and also take data back to these AI developers, completing this whole 360-degree loop. And of course, it allows us to run clinical trials and make these AI systems better. Today, we are the world's largest AI marketplace for radiology solutions with more than 60 applications on our platform. We are also the world's first AI testing and monitoring platform, and we're deployed at some of the world's leading groups that I'll just talk about. The simplest way to understand what we are doing, and I understand that this is probably a niche within a niche, is that we are a single techno-commercial integration layer between healthcare providers and AI applications. So if you look at all the things that AI can do today, that all of these companies are doing, these are all well-funded companies from across the world. We encapsulate the value of all of these companies through a single interface. And I'll show you a quick demo as well. These are some of our users from across the world. As you can see, it spans academic institutes, large healthcare providers, and large radiology chains. And our target markets today are Australia, Singapore, Brazil, and the US. And now we're starting to enter into the UK as well. We essentially operate at the intersection point of a large healthcare provider. So, any healthcare provider that does at least 3 to 5 million scans a year, and those who already understand the value of AI. So then we only have to pitch our platform to them and not pitch the value of AI, which makes our task much easier. This is a list of the companies on the other side that we work with, all our AI marketplace partners. We have about 30 of them, channel partners, integration partners, tech partnerships, and then, of course, our platform as a service users, which I'll just tell you more about. We've written about 12 papers on AI deployment, AI validation in this field. We presented 120 plus papers at RSNA, ECR, which are two large radiology conferences. We've run about 12 clinical trials, etc., for some of these people. We have a three-pronged commercialization strategy. The first is, of course, the data and clinical trials. This is easier to understand. Any AI solution today to sell in the US or Europe or anywhere in the world requires a clinical trial. We use our install base of healthcare providers to run these clinical trials. These are typically one-time deals based on very niche needs that these developers of AI have. Second is the AI marketplace model, which is where our exponential growth is going to come from, where we take these AI applications and put them into hospitals, and then hospitals pay per click or pay per scan for these solutions. And then is our platform as a service offering, where there are a certain subsegment of companies out there that find value in the entire software stack that we've built, which allows them to do a bunch of things. I'll just show you in a bit. And they pay us an annual or a monthly license for using them. Suffice to say that each and everything that we have built on the platform has been built to accelerate this middle part, the AI, the adoption of AI, because the fundamental truth of our industry is that everybody is building AI, nobody's using it. So we're trying to be the usage channel for AI. We add value on both sides of the market. For AI developers, obviously, they don't need a sales team. We become their GTM partners. We provide them real-time feedback on what it is that, how it is that their model is performing, what are clinical and commercial levers that they need to pull. We accelerate regulatory approvals for them. And of course, we give them upfront revenue since we are a distributor of them. On the healthcare provider side, we serve as I said, a single techno-commercial interface. So the typical distribution model, right? A hospital doesn't need to talk to 100 companies. They just talk to us, both from a revenue and an API standpoint. Significantly lower procurement cost. We are negotiating with these companies globally, right? So even if you are the biggest player in your geography, we will still probably be able to get you a lower cost for AI than what you could get otherwise. Of course, you could try before you buy multiple AI systems on our platform with a single click. You can get access today to about 62 applications. We are adding 5-6 applications every month. And of course, it's a cool way to start monetizing domain and data expertise that you may have in your hospital system. In terms of the team, so we are a unique company in that sense. We were incubated at Mahajan Imaging, which is one of India's largest radiology players, which is what I was running. So we started in 2018 as an in-house research group with just a couple of people. Today, we've scaled up to about 30 people full-time just running CARPL. I serve as the CEO. My colleague Vasant serves as the chief medical officer. Rohit's our tech guy. He's our chief architect. Salil handles all our deployments. And, we have a very actively growing team now. And on the our angel investors and advisors are some of the most well-known people in the industry today as well. In summary, and then I'll go into a quick 2-minute demo. We allow healthcare providers to first discover AI solutions, then run these AI solutions on their own data to figure out value, test these AI solutions to figure out if they even work, and lastly, orchestrate the deployment of these AI solutions into their practices. With that, I will switch to a quick demo. So this is what CARPL looks like. We were lucky. We had a graphics designer who had never made anything for healthcare before. So he used to build games. So this is our AI storefront of sorts. Again, multiple AI systems, single interface. These are all companies, all valued in like hundreds of millions of dollars. If you're an academic institute, you can add your own algorithm. You can create all sorts of workflows. You can pick algorithms, link them to data sets. You can connect algorithms, ensemble them, n number of features. We have a full data management stack, annotation stack. What I personally feel the clinicians on the call might enjoy is the ability to interview an AI using our validation platform, where once you've got data and you've got AI and you can run statistics automatically. These are AUC values. These are, this is a dot plot where you can figure out false positives, false negatives. You can look at what the AI said, what the ground truth was, what was the actual image, so on and so forth. And how we go in front of radiologists is like this, where we go and sit in the packs. So the interface that I just showed you is typically used by the chief information officer or chief medical officer of an institute. But what the end user, the actual radiologist sees is simply either another window of CARPL in their pack, so they don't need to go into 20 different applications for 20 different AI solutions. Everything happens in their native environment. They don't need to go anywhere else. Or they will start just seeing an alert or an automatic report in their work list. So with that, I'll pause. My time is done, but happy to answer any questions.
Good. All right, let's ask, let's see, who was the last person I asked? Maybe Doreen.
Yeah, so I'm very excited about AI application in general. So welcome to the club, going rogue. For me, it's always, can we trust it? And what is the transparency with the algorithms we are using? So you showed a little bit about the validation process, but how do you know when you can trust your algorithm?
No, so absolutely. In fact, I'm glad you asked that question. So we are the only AI platform on the planet to also have built in a bias and fairness estimation toolkit right into the platform. We use University of Chicago's Equitas framework for that. And we have also published the first paper on medical imaging AI explainability, which was in academic radiology. We called it Unboxing AI. Because you are absolutely, and then we've come up with metrics for measuring explainability from a clinical perspective. We called it clinical explainability failure, which is this idea, and it relates extensively to trust of, as data scientists, nobody really looks at true positives, right? Where the AI and the human said the same thing. Nobody looks at the reason why the AI and the human said what they said, and many times there is not overlap. So the AI may say pneumonia looking at something completely non-pneumonia like, whereas the human looked at an opacity on the lung. So that is one of our core principles, is trust, and that's why we've built out the whole validation solution with like maybe more features that are required.
And just a quick comment, we are now at the quintuple aim of healthcare. So we added 2 more aims to the triple aim, which is just a FYI. Thank you.
Sorry. Thank you.
All right, Dana, do you want to go next?
I'm going to let Vince go first.
Okay, Vince.
Sure. So first, I really enjoyed your graphical user interface. I think it's on one screen, which is very helpful, and toggling many screens. A couple of clarification questions. What is the value when you talk to the CXOs? How do you sell your value? Because you have a bunch of AI applications and you are the middleware. I remember service-oriented architecture, something like yourself developed 10 years ago with web methods and CBeyond. So you recall me and refresh me. So I personally believe this will work. So the question is, what's the value and what's the pricing model?
Sure, Vince. So value, essentially increase productivity and better outcomes, right? That's what we're all aiming for. So if you think of it today, there is a huge demand supply mismatch between availability of radiologists and scans that need to be read by radiologists. Like a relatively small country like the United Kingdom itself has a shortage of some 2,500 radiologists, so on and so forth, right? So AI will lead the fore on productivity. So how can I go, like in the world of pathology, how can I go from taking a radiologist reporting 50 scans a day to 500 scans a day, right? Where they may be still physically looking at only 50 scans with their eyes, but they sign out 500 scans. Once that happens, the cost of healthcare delivery falls exponentially. Again, like what's happened in lab medicine. Because if you think of it from a financial perspective, radiology is a fixed cost business, once you've bought the machine, once you've got the techs in place, whether you do 50 scans a day or 10 scans a day, your cost is the same. The problem comes in because the radiologist only has a finite amount of time and mental bandwidth to be able to operate for, say, about 10 to 12 hours a day. So how can you, so by bringing in AI, can you do things like automatic normal discovery, right? So mammograms, 90% of mammograms are normal by design. What if out of those 90%, 70% could be taken off by AI?
Okay,
Right,
so
that in
let
itself
me
is a
interrupt
several
you.
billion-dollar opportunity.
Let me interrupt you in the interest of
Please,
time.
please.
We only have
Yes.
limited time. The question is, how do you actually position? I understand. I'm a tech entrepreneur, so I totally understand. I was giving you an analogy of CBON and web methods before.
Yes.
How do
Yes.
you position at a C-level CMO, Chief Medical Officer? Do you do some research before they do the AI application? When you say reduce the cost and operational efficiency, those are big consulting words, which I
Yes.
appreciate. But we have to go beyond that, saying, I'm going to reduce this by X factor, speed up by Y. So how do you
Yes.
assess?
Oh, of course. So we start, Vince, with a retrospective study, right? Where we will take a couple of months worth of data, process it to the platform, first figure out clinical value, because without clinical value, we can't go to economic value. So we start with clinical value and then go to economic value. Clinical value levers are easy. We've just talked about that. Economic value comes from productivity and automatic scanning. So we don't take these solutions in front of radiologists till we have established both, because it's counterproductive. So it's a much longer answer. Happy to connect offline. I would love your
What is
thoughts
the
on that.
pricing model? We didn't never talked
A
about
pricing
that.
model, we have a 30-70 revenue split. I didn't put it on the slide because you don't know where this stuff goes. It's a 30-70 revenue split that we have with the AI companies. So hospitals pay us $100, we keep 30, pass on 70.
Okay, thank you.
All right, Dana, do you have any questions?
Yeah, I think it's more of a comment. If one thing I would say, to just echo what Vince said, because it is really exciting, and being in the industry in the US and having these conversations constantly with our client, it is very frustrating because everybody talks that talk and you want to see results and outcome. So I would be like more specific with the messaging and examples and some more numbers in there, yeah, it would be helpful. But a great idea. Would love to see this proven to work.
Thank you. Thank you so much.
All right. Thank you very much, judges, and thank you, Vidur.